everyone. Today we are going to present to you Middle Adulthood by Margaret and
Caprice.
This presentation is based on chapters 15 and 16 of our textbook. So middle adulthood spans the age range from around 40 years old to around 60 years old. And in this presentation, we'll cover a range of topics, starting with physical and cognitive development and including emotional and behavioral development of people in this age group. Okay, physical development. There are significant changes in physical development in middle adulthood. These include decreases in muscle and bone mass, decreased energy levels, longer recovery periods after accidents or strenuous activities, changes in vision, such as farsightedness, changes in hearing, such as tinnitus or hearing loss, and changes in hormonal levels. Most physical changes can be accommodated through minor adjustments, for example, getting glasses or avoiding hangovers. Although most adults do not have significant health problems entering middle adulthood, this is a period of life when significant health problems can begin. Health can be improved through lifestyle choices. Diet, exercise, limiting alcohol, and not smoking are healthy choices that will improve physical performance in middle age. The earlier in your life you make healthier choices, the more of an impact it can have later in life. Physical attractiveness. How people perceive their attractiveness differs individually and by social cultural norms. Changes in outward appearance become noticeable in middle age, and these can include changes in skin firmness and elasticity. Sun damage that a person acquired in their youth could start to be more apparent in middle age. Middle age can be associated with weight gain and even loss of height due to changes in bone mass and bone density. Bybee and Wells, 2006, found that although attractiveness is important in middle adulthood, adults begin to think of other factors related to their bodies, such as overall physical health, strength, and living longer disease-free life. Therefore, care for one's physical appearance may be motivated more by maintaining good health than by appearances. And this may be true for many people. However,
per the American Society of Plastic Surgeons, in 2019, there were 7.9 million plastic surgery procedures completed for adults in the age range of 40 to 54.
The American Society of Plastic Surgeons actually keeps track of all of the plastic surgeries and cosmetic procedures that happen in the United States, and they produce a report every year. This is the report for 2019. They categorize the report by age groups, and the age group of middle adulthood that they classify from around 40 to 54 is one of the age groups that has the most medical procedures. This is more than other age groups and represents a 1% increase from 2018. The most common procedure was Botox, followed by soft tissue fillers. The amount of surgery completed for the age group of 30 to 39 was less than 3 million. So it really more than doubled for middle adults in 2019. And I think this is a indication of how important physical attractiveness is for this age group and how they're willing to actually take action in order to remedy what they might perceive as a loss of attractiveness.
I also think it's worth mentioning that the vast majority of these cosmetic procedures that were reported are for women. Around 90% or more of these across the board are done on women, which might be an indication of the kinds of pressure that women especially feel in order to maintain a certain standard or level of quote unquote attractiveness. And it's also an indication that men might feel this kind of pressure to maintain a certain physical standard in a different way. That's not reflected through this report about cosmetic surgeries. So that's worth noting.
Sexual and reproductive health. Sexual encounters may decrease due to changes or not. Researchers actually disagree on this. Most adults still find sex pleasurable. termination of long-term relationships has been associated with higher levels of risky sexual behaviors in men and women. And a significantly larger number of middle-aged adults are living currently with STDs, HIV, and AIDS than past generations. And this is concerning because if a person in middle adulthood nowadays does engage in risky sexual behavior, they are exposing themselves to a lot more diseases than in past generations. Sexual changes usually occur sooner for women than men. Menopause is associated with this stage for women, but in addition to and aside from menopause, women may also experience fibroid tumors in their reproductive organs, causing discomfort and bleeding. For men, men as young as 40 can experience a decrease in testosterone, which affects sperm count, quality of orgasms, and length of time needed between arousals. Sexual dysfunction is a big topic in middle age. It can be a very traumatic development. Often it is associated with other conditions. One type of sexual dysfunction that may arise in middle adulthood is erectile dysfunction. This can be associated with depression, trauma from childhood, past sexual abuse, stress, intimacy problems, or even drug use.
Because this is a topic that I am not very well versed in, I found a video from Stanford University Hospital that explains the context of this type of sexual dysfunction much better than I can.
Erectile dysfunction is defined as the recurrent or consistent inability to attain or maintain an erection for a satisfactory sexual experience. Erectile dysfunction is very prevalent in this country. Large epidemiologic studies that have looked at men estimate that it's probably about 50% of all men in this country aged 40 to 70. And other estimates say that over the next 10 years, the overall number of men affected by erectile dysfunction is estimated to increase by about 300 million. There are many known risk factors for erectile dysfunction. In the past, it was thought that most of it was psychological, but we now know that probably 85 to 90% is due to an organic cause that we can identify. So the predominant ones would be cardiovascular risk factors such as blood pressure, diabetes, smoking, obesity, certain medications, either medications given for depression or other psychiatric conditions, as well as medications for blood pressure. We know that erectile dysfunction is a common problem after prostate cancer treatment. What we're also learning is that right after, in the immediate postoperative period, it's very important to enroll in an aggressive penile rehabilitation program in order to sort of set the stage for maintaining penile health. Again, the adage that if you don't use it, you lose it is in a lot of ways true. So, normally we're used to getting erections every day, and if we don't do that, get this normal oxygenated blood into our penises, we have problems. There are some psychological causes of erectile dysfunction, and it typically is sort of a self-fulfilling prophecy in some ways. So performance anxiety has become an issue. A lot of times patients will have normal erections in the evening and the morning, suggesting that all the architecture and the hardware is intact, but there may be underlying psychological conditions. I always tell men, in order to prevent erectile dysfunction, you should live a healthy lifestyle. So anything that's good for your heart is going to be good for your penis. So good diet, exercise will all benefit. There are a lot of great treatment options for erectile dysfunction. So usually we start with oral medications. These would be the phosphodiesterase inhibitors. Certainly ones we're familiar with, Viagra, Levitra, and Cialis, and they all do work very well. If those don't work, we move on to some other options. So the first thing I usually talk to men about is a penile injection therapy. There's also medications that we can put in the tip of the penis and then absorbed in the penis that work very well. There's something called a vacuum erection device. And if none of these work or men aren't satisfied with any of these, there's even surgery we can do to put in an inflatable device in the penis. Another very interesting thing about erectile dysfunction that I think all men should know is that it's oftentimes a precursor to other medical problems. So a lot of times erectile dysfunction will be the first thing that men notice. And, it can actually precede cardiovascular disease by 3 to 4 years. I think most men probably do not realize that. I think that a lot of men think that things change as they age, and to a large extent that's probably true, but things can happen a little earlier than they need to, and it can be warning signs for other problems that can be averted. And more than that, there's interventions that we can institute that help maintain function.
All right, now for our next fun topic, menopause. Menopause is a gradual process that occurs over several years. It typically starts between ages 45 to 55. During menopause, menstrual cycles reduce, become irregular, and eventually stop. As hormone levels fluctuate, symptoms fluctuate, and menopause is associated with a loss of fertility. This slide covers or illustrates the 4 stages of menopause. They include perimenopause. That is the stage that starts usually during your teenage years and when your menstrual cycle starts. It is associated with high estrogen levels and high fertility. Then in between the ages of 35 to 55, the perimenopause stage will start. And this is sort of the transition period to menopause. Some women may experience early menopause due to illnesses, genetic components, or medical procedures such as hysterectomies. Symptoms can include night sweats, hot flashes, mood swings, and weight gain, along with other unpleasant side effects. And stage 3 is actual menopause, and this represents the end stage of a natural transition in a woman's reproductive life. Menopause is associated with at least 12 months or more of not having a menstrual cycle. And perimenopause and menopause are the stages that are associated with middle adulthood for women. Interestingly enough, birth rates for women over 40 are increasing. This information from the CDC is from the last report on this topic, which came out in 2012, and it illustrates how women ages 40 to 44 have actually increased steadily in their birth rate in the United States. Among the oldest mothers, increases in first birth rates were largest for non-Hispanic Black and for non-Hispanic white groups of women. Of all race and Hispanic origin groups, Asian Pacific Islander women at age 40 to 44 had the highest first birth rates from 1990 to 2012. And this can be due to a lot of different reasons, including better access to medical care, advances in medical technology, including IVF, and women postponing having children and families until later in life. But it is an interesting trend because this means that as counselors, we might be working with women and with families who in middle age are still going through fertility journeys or are just starting to have parental responsibilities. Whereas in generations past, typically a person in middle adulthood might already even be a grandparent. So this is an interesting trend that's happening. And for the last few years, women over 40 are having more babies than teenagers in the United States. So I thought this was really interesting to point out. Okay, important to the counselor. Socioeconomic factors are impactful to health issues, including access to health care, reproductive treatments such as IVF, elective surgeries, and preventative interventions. Gaps in physical health between different socioeconomic groups tend to widen during middle age. So if you were a person who was born to a disadvantaged socioeconomic group who maybe did not have great access to medical care, it's possible that during middle age, that disadvantage might exacerbate other aspects of your life as well or become more of an issue. Minorities may be less willing to seek medical resources or assistance, which may lead to lingering physical problems and chronic health conditions. Relationships impact physical health. So stressful environments can affect sleep patterns, weight gain, and produce lower levels of life satisfaction. So relationships are extremely important.
Thanks, Margaret. So I am going to talk a little bit about cognitive development in this stage. So in middle adulthood, we have what is called fluid intelligence and crystallized intelligence. And I'm taking some of this information from this chart on page 458 in our textbook. And it's just a nice reference to look at when you're working with people in middle adulthood. to see what changes are going on, what's normal and abnormal in their cognitive development. So with fluid intelligence, this is the ability to reason and solve problems in new situations, regardless of what has already been learned. So these are things like solving problems using logic. And this slowly declines throughout middle life or midlife into old age. And then there's crystallized intelligence. And this is the use of one's acquired knowledge and skills to solve problems. You can use your personal experiences and wisdom. These play a role in that. For middle adulthood adults, this stays stable and it improves through midlife, which is kind of interesting because we often equate younger students maybe with fluid intelligence and then older students with crystallized intelligence. In our textbook, it also talks a little bit about early Alzheimer's or dementia. This is not common at this stage of development. However, it can happen depending on someone's genetic disposition or other medical conditions that they have. And if they do, then they may have an early onset. And so I decided to share a picture of me and my mom here. So this is my mom, and she is a person who was diagnosed with Alzheimer's early onset. So she's 65 right now, and she was diagnosed a year ago, but a couple years before that, she was diagnosed with mild cognitive impairment. So one thing for me, I really would like to avoid having that experience. So it's really important to focus on good sleep and increased physical activity and a healthy diet. And there are other things as well, but these are some basics that can help with your cognition. Also in our textbook, it said that, in middle adulthood, there are a lot of roles to play and you're very busy and you might have a stressful life. And so a lot of our memory issues that can occur during that stage comes from just being busy and not necessarily having dementia or Alzheimer's. Okay, impacts of trauma and mental health on cognition. So we have two things here, physical and mental. With physical, there's traumatic brain injury or TBI, physical trauma or toxin exposure. These things are more connected with people who are veterans or actively enlisted, and not as much with the civilian population, but that's something to consider. Also, the work environment. Someone who works in a more physical environment might be at a higher risk of injury. And then also frequent driving, people who have jobs where they're drivers or maybe they commute to work, so that increases risk of accidents. For the mental, it looks like, 1 to 2 of every 10 adults experience some degree of anxiety or depression. And there's a nice table, it's 15.2 on page 461, that has more information about mental health. And also there's physical trauma or PTSD. This can also impact cognition with problems with memory, thought content, and negative symptoms. As a counselor, if you are working with someone who's in this stage of development, it's not good to assume that it's a neurocognitive disorder without carefully ruling out PTSD or maybe another stressor that could be related. Okay, now I'm going to talk about sociocultural factors and cognitive development. So the first one is gender. Emotional, psychological, and social health levels during middle age are consistent for both male and females and may increase with age. Traditional roles may switch, but some men may feel more conflicted and they may turn to self-harming behaviors. Women tend to develop new hobbies and continue working on their personal development. Ethnicity and race. In both Caucasian and minority backgrounds, social activities have a positive impact and helps reduce symptoms of depression. However, reactions to stress and depression may differ. For example, minority women tend to be caregivers and they may use the computer less often. So counselors need to be considerate of different ways that people may handle their stress or have stress management. Sexual orientation. Within the LGBTQ community, sexual orientation identity development continues through middle adulthood. And according to our text, gay, lesbian, and bisexual adults tend to have a higher risk of developing mental health problems, along with higher risk of smoking, excessive drinking, and disability compared to heterosexual men and women. Family relationships. Healthy cognitive performance is influenced by biological inheritance along with family and other social networks. Chronically poor quality relationships can contribute to ADHD, depression, and anxiety. As we give middle adult family members and friends our understanding, compassion, and care, we can help them to navigate the changes that they're experiencing and to help them with their well-being. Vocational and socioeconomic status. Adults with poor work histories or lower than average cognitive abilities may suffer from low self-esteem, maladaptive coping such as substance abuse, and lower socioeconomic status. They may also suffer from ADHD, depression, and anxiety. Okay, so important to the counselor. As you think about working with someone at this stage of development, these are some items that you can work on, such as rapport building, listening, being familiar with the things that they may be going through in their life and providing a high level of comfort. Sociocultural assessment. These are the items that I just spoke about on the previous slide, like family relationships, vocations, their gender, etc. Just to consider these different areas that might be affecting them. Biopsychosocial assessment, physical and cognitive. And on page 458, it lists some things that you can look at if you are doing that assessment. So for example, if you are looking at the physical, you could look at their current height, weight, and BMI, their physical activity, medical history, appetite and eating patterns, their body image satisfaction, substance abuse history. These are just a few items. There are others. With cognitive development, they can look at their mental status and have them take the mental status examination or a referral to a neuropsychologist if the person is having cognitive decline that's abnormal for middle adulthood. And the last one is developing treatment plans collaboratively. In the case of Amelia, they talk about wellness practices, individual counseling, and referrals.
Okay, theories that are associated with middle adulthood. There are a plethora of theories associated with middle adulthood. A lot of them are highlighted in the book, and these are several of those. I know that we've actually reviewed a lot of these in past presentations, and we're familiar with them from case studies and reading the book, but I thought it would be important to highlight how some of these theories apply to our focus here, which is middle adulthood, starting with Erik Erikson. So Erik Erikson's theory considers middle adulthood to be from the age ranges of 34 to about 60 years old. Middle age is faced with resolving the conflict between generativity and stagnation. Generativity in this case means concern for the well-being of future generations. And a person who resolves the conflict between these two things eventually becomes more caring as a result. Erikson also associates the stage with doing career reevaluations, which can be stressful. So coping strategies for this stage include flexibility, creative problem solving, and a sense of humor. Lawrence Kohlberg has different stages associated with morality, and there are 6 stages that are grouped under these 3 categories of pre-conventional, conventional, and post-conventional. Pre-conventional is associated with obedience, avoiding punishment, and acting in self-interest. Conventional is associated with adhering to social norms and maintaining individual relationships. And post-conventional is about ethical principles that can be applied more universally and that entail justice for all. These stages of morality are not tied with any age. So if you are a counselor and meeting with an adult, you cannot expect them to be in one stage of morality versus another. They could be in any of these stages. Jean Piaget has a couple of stipulations about middle adulthood, and they include that as people mature, so does their ability to build on prior schemas, prior frameworks, and prior knowledge. And the two stages that are most associated with middle adulthood are concrete operational thought, which is the ability to think clearly about objects and events, and formal operational thought, which is about thinking logically, more about abstract and hypothetical concepts. In Western culture, we would associate adulthood and middle adulthood more with formal operational thought, but this might be more of a cultural expectation that is not necessarily applied universally. Daniel Levinson, he proposed that there are 4 eras in life, and he called them the seasons of life. Each era lasts approximately 25 years, and middle adulthood would be the era of around 40 to around 65 years old, with the following stages associated with this season. The first is midlife transition. So from about 40 to 45, this may entail an evaluation of your life choices up until that point, and you might have certain psychological crises associated with where you are versus where you thought you needed to be. Then there comes entering, which is 45 to around 50. And in this stage, you face choices about relationships and careers. After entering comes the stable period or transitional period, depending on the person's dreams, goals, and the results of the evaluations that they did of their relationships and career. Lastly comes the culmination stage, which is around age 55 to 60, and this is a transition period to late adulthood. Roger Gold, he came up with an age-related sequence of levels, and middle adulthood would start around 35, and around 35 to 45, Roger Gold would say, we begin to address midlife concerns such as death of a loved one, health, personal status, and our own morality. And around 43 to 50 years of age, there's a reconciliation about kind of where we are in life and the choices that we've made and how we now understand them. And a mellowing out that occurs that leads to stability and acceptance. Okay, this is the last slide about theories. So we have George Vaillant. He has 6 tasks that are associated with a person's adult life. And most of these tasks can be completed in middle adulthood. They include developing an identity, and this one can occur in middle adulthood, although typically would associate this more with our teenage years and early adulthood when we are kind of challenging our belief systems, finding our identity in our social group, maybe challenging some of the beliefs of our parents. Then there's intimacy, developing relationships. Then there's career consolidation. So that is about more about finding your purpose in the world and how you can contribute to society and also make an income. Then there's generativity. The way I think about generativity is about generosity. So generativity kind of reminds me of generosity, and that's more about giving more back to society and wanting to kind of pave the way for future generations. Then there's becoming the keeper of meaning, and this is associated more with becoming a keeper of tradition, sort of passing traditions down to the next generation, becoming the storyteller of your family, for instance, about what happened previously in your lives or in your groups. And lastly, there's integrity, or a sense that peace that develops from your life and the choices that you've made in later adulthood. Okay, and then we have Bernice Newgarten. Bernice was an American psychologist who specialized in adult development and the psychology of aging. And she came up with the social clock theory. She challenged the notion with this theory that adulthood should be viewed as a progression of stages tied to age ranges. Different cultures have different timelines and expectations for tasks, and tasks shouldn't necessarily be associated with a certain age group. And basically, she said things vary with culture, and that is okay.
Okay, I'm going to talk about issues on social and emotional development. So during middle adulthood, it may be the best time to work on trying to understand ourselves and our continuing identities. There's this self-concept clarity concept that Lottie Smith and Roberts have come up with. They had some studies that they had done, and they found that there is a curvy linear relationship in respect to age. And so it kind of goes up through young and middle adulthood, but then it kind of decreases in older adulthood. So they were saying that middle adulthood might be kind of this peak where we can learn more about ourselves and our identities. This is also a time of life when people are working a lot. Most people, but not all, may have a stable career or a job that they've been at for many years. They may have some job promotions, leadership positions, working with different people, having different responsibilities, which can bring on more stress. The book did talk about working independently or in groups, so you can have some personal and professional development still going on while also having some interpersonal skill challenges. And for other people, they might take this time to make transitions in their careers or go back to college. And so these are different things to think about at middle adulthood. Also, some people might experience a loss of employment, underemployment, or unemployment. And these can affect a person's self-esteem and their insecurity, kind of going along with something Margaret mentioned, that a lot of people between 40, 45, they're thinking about where they ought to be in life or what they have accomplished thus far in life. And so if they're not happy with their current circumstances, they might feel badly about what they have done or what they haven't done. This is also a time of life where people are planning and anticipating retirement. They're kind of looking ahead, thinking how to prepare when that time comes. So speaking of stress, middle adults do have a lot of stress in their lives with their careers, their families, their different roles to play. And so I thought it would be nice to look at a different viewpoint on stress. This is one of my favorite TED Talks. It's called How to Make Stress Your Friend by Kelly McGonigal. She also wrote a book. It's called The Upside of Stress, and she wrote this back in 2015. And so I encourage you to watch this TED Talk or even read her book if you're interested in learning how you can better handle stress. So we're going to just watch the first couple minutes of her TED Talk. It's kind of a teaser to get you interested. It's really entertaining, but also very informative.
I have a confession to make. But first, I want you to make a little confession to me. In the past year, I want you to just raise your hand if you've experienced relatively little stress. Anyone? Mm-hmm. How about a moderate amount of stress? Who's experienced a lot of stress? Yeah, me too. But that is not my confession. My confession is this: I am a health psychologist, and my mission is to help people be happier and healthier. But I fear that something I've been teaching for the last 10 years is doing more harm than good, and it has to do with stress. For years, I've been telling people stress makes you sick. It increases the risk of everything from the common cold to cardiovascular disease. Basically, I've turned stress into the enemy. but I have changed my mind about stress. And today, I want to change yours. Let me start with the study that made me rethink my whole approach to stress. This study tracked 30,000 adults in the United States for 8 years. And they started by asking people, how much stress have you experienced in the last year? They also asked, do you believe that stress is harmful for your health? And then they used public death records to find out who died. Okay, some bad news first. People who experienced a lot of stress in the previous year had a 43% increased risk of dying. But that was only true for the people who also believed that stress is harmful for your health. People who experienced a lot of stress but did not view stress as harmful were no more likely to die. In fact, they had the lowest risk of dying of anyone in the study, including people who had relatively little stress. Now, the researchers estimated that over the 8 years they were tracking deaths, 182,000 Americans died prematurely, not from stress, but from the belief that stress is bad for you. That is over 20,000 deaths a year. Now, if that estimate is correct, that would make believing stress is bad for you the 15th largest cause of death in the United States last year, killing more people than skin cancer, HIV, AIDS, and homicide. You can see why this study freaked me out. Here I've been spending so much energy telling people stress is bad for your health. So this study got me wondering, can changing how you think about stress make you healthier? And here the science says yes. When you change your mind about stress, you can change your body's response to stress. Now, to explain how this works, I want you all to pretend that you are participants in a study designed to stress you out. It's called the social stress test. You come into the laboratory and you're told you have to give a 5-minute
Okay, I went a little bit over because I just got engrossed in watching it again. So hopefully you will too. But yes, I really like this TED Talk because it kind of changed my viewpoint on stress when I first saw it several years ago. And it's a good reminder to look at stress in a more positive light. Okay, let's talk about relationships in middle adulthood. So there are several roles to play in middle adulthood. There, are people who are employees, employers, parents. They have spouses or significant others in their lives, their friends, they're still children. So sometimes people in this stage may experience what is called role overload. One of the roles that middle adulthood adults have is being in that parental role still. Many parents at this stage have adolescents in their home. However, that's not necessarily the case, as was mentioned by Margaret, that people are having children later in life. So these parents may have younger children in their home still. And this is an example of being outside that social or sociocultural norm. And so, if you're divorced or if you're widowed or you don't have kids or you've never been married or you don't have a partner or spouse, you might be outside that sociocultural norm. And this can sometimes be difficult for people in middle adulthood because they think that they should be at a certain point in their life, whether it be with family or marriage or kids or career. And so this is something just to be aware of, is if that person that you are working with is outside of the typical sociocultural norm. Also, many middle adults find themselves raising their grandchildren. And in the book, it mentions that nearly 3 million kids are being raised by their grandparents. And then there's also the role of taking care of aging parents. So a lot of people that fall into this stage are taking care of their parents, or they're starting to take care of their aging parents. And so you can kind of see all these different roles and how this overload can occur. Okay, now we're going to talk about partner relationships to kind of go along with relationships in general, but to be more specific. So, with partner relationships, there can be a stress that impacts relationship satisfaction, such as early attachment experiences. So, this is a video that Margaret found on childhood neglect. And it's a really good video because it talks about some research that has been done from the American Psychiatric Association, and this was in 2013. So they go over their findings about childhood neglect and how it affects later adult relationships. And so we're going to go ahead and watch that right now.
Childhood neglect correlates with impaired adult capacity for close relationships, a survey of 114 non-psychotic psychiatric inpatients found. Dr. Lisa Cohen reports the findings.
Know that childhood maltreatment is a risk factor for many different types of psychiatric disorders. For example, eating disorders, depression, personality disorders, and many others. Also a risk factor for health disorders, physical health disorders. However, the research on the adverse effects of childhood maltreatment has really focused primarily on the more kind of dramatic and visible and physical types of maltreatment, such as sexual abuse and physical abuse. And while this is certainly very important, the base rates of this kind of abuse is not as high as the other kinds that aren't quite as dramatic, such as emotional abuse and neglect. And it's only recently that we've really been paying attention to the impact of emotional abuse and neglect. So we were interested in whether neglect per se had an impact on interpersonal functioning in adults. So whether people who were neglected by their parents as children reported when they were adults that they had more difficult times with interpersonal relationships. We looked at 114 non-psychiatric inpatients. We used two different measures, the multidimensional neglectful behavior scale, which has a total score in 4 subscales: supervisory, cognitive, physical, and emotional neglect. And then we looked at the severity indices of personality problems, which is a self-report questionnaire. And we specifically looked at the relational domain and the scales for enduring relationships, intimacy, and feeling recognized. And what were our findings? Well, basically everything was correlated with everything. So it's a very strong finding that reported history of neglect is associated with difficulties with relationships in adulthood. But one of the things that I found particularly interesting is if you look at that column in red, the enduring relationships was most strongly correlated with the different types of neglect. So what this suggests is that while people who've been neglected report difficult times with relationships in general, they seem to have a specifically difficult time with maintaining relationships above and beyond just engaging in these relationships. So in conclusion, our data links childhood neglect to impaired capacity for close social relationships among non-psychotic psychiatric inpatients. And the deficit seems driven by problems with sustaining relationships more than the ability to engage in close relationships at all. So I think this is something we want to pay attention to with our patients, is not only can they get in relationships, but can they maintain them over time?
Okay, so at the very end of the video, I like how she pointed out how the effects of childhood neglect on relationships is there, but especially on maintaining those relationships in the long term. So that kind of leads me into our next slide. This is the Adverse Childhood Experiences and Adult Attachment Interview in a Non-Clinical Population article, which was shared by Alex. And I feel like this can connect with the video we just watched. So with the findings of this research study, they found a relationship between increased adverse childhood experience exposure and a greater lack of resolution of past trauma, more adult traumatic events, and more difficulty disclosing past trauma. However, 51.4% of participants with more than 4 of these adverse childhood experiences were classified as secure in attachment. And so they drew this conclusion that the people who were in this 51.4%, they participated in higher education and other meaningful activities, which were contributions or possible contributions to their resilience and their secure attachments. So the previous video didn't talk about anything like that, but this kind of shows that if you do have meaning in your life, or you're participating in meaningful activities to you, that it can help you to be resilient and to heal and recover from any of those past experiences that you had. So going into some more on relationships, we have here the Gottman Institute. And this is another website that Alex shared with us. So Dr. Gottman, or John Gottman, he has been doing research since the 1970s. So he's been around for a long time doing this. And in the beginning, he was looking at behavioral patterns between happy and unhappy couples. And then he did this really, really long study, and it was a divorce prediction study. And he recognized that the perpetual problems that, never really got resolved within a couple, they just kind of like never really got resolved. And they were mostly personality differences. So he came up with this metaphor. It's called the 4 horsemen of the apocalypse. And there are 4 areas: criticism, defensiveness, contempt, and stonewalling. And he found that couples that experienced all 4 of these would divorce after 5.6 years of marriage. And they got to this point where they were able to predict this with 90% accuracy. So the Gottman Institute is well known, and Dr. Gottman, he does workshops and he talks to different groups, and there's research that is still going on. And I've included the link to the website at the bottom of this page. And then lastly, I'm going to talk about spirituality. So there is the religious dweller and the spiritual seeker. So the religious dweller is a person who follows the doctrine of an established religion and participates through prayer and worship. The spiritual seeker, on the other hand, is a person who seeks a more independent path outside of traditional religion. And Dylan in 2003 did a study that spanned over 60 years. And they found that religiousness and spirituality positively correlated with generativity. So the more engaged a person is spiritually or religiously, the more concern they have for future generations and can find stability in middle adulthood.
Important to the counselor. So just to recap a lot of the things that we've mentioned in this presentation, there are 3 big aspects of middle adulthood that are likely to come up in counseling: relationships, career, and spirituality. With relationships, you have children, parents, partners, and possibly even grandchildren. They are all extremely important to a person's life satisfaction levels. And so it will be important for us to help clients navigate their relationships. And there are tools for that, such as those made by the Gottman Institute. So if you do check out their website, they have so many different kind of books and explanations and studies that are available. And this picture is actually of a board game that they have that I purchased like a few years back. So I'd be happy to lend this out if anybody is interested. But they have all kinds of tools available to help people navigate relationships and learn more about how to help make relationships work in the long run. Then you have careers. Careers are linked to all kinds of things in a person's life, including their livelihood, self-esteem, sense of productivity, their socioeconomic status, and even their sense of generativity. So that might be another aspect that would come up in counseling, helping a person navigate big career questions. And lastly, there's spirituality. So a person's spiritual beliefs may come into play in middle adulthood because it's during this stage that people start to ask themselves a lot of questions, coming to terms even with their own mortality, having existential questions, might have health concerns that propel them to think about the end of their life. And so spirituality might take on a different meaning for people in middle adulthood. And it can also be related to generativity and a person's moral compass or sense of morality and moral development. Even though a lot of the topics that we have discussed today seem scary and stressful, the reality is people get happier with age. It is unprecedented in our history to have so many people that are reaching middle age and beyond. Just 100 years ago, the life expectancy for an average adult person in the United States was around 58 for men and around 60 years old for women. People died before even exiting middle age. Now life expectancy is much higher. I believe it's around 80 years old for the average person in the Western world. So people have long and fruitful lives ahead of them, even once they have reached middle age. And this is a great video that we found that references a few studies about middle adulthood and a person's sense of happiness. And we're just going to play the first 6 minutes of this so you can get kind of a taste of what this information is about. And we also include a link to this video in our reference section in case you want to watch the whole thing.
People are living longer and societies are getting grayer. You hear about it all the time. You read about it in your newspapers, you hear about it on your television sets. Sometimes I'm concerned that we hear about it so much that we've come to accept longer lives with a kind of a complacency, even ease. But make no mistake, longer lives can, and I believe will, improve quality of life at all ages. Now, to put this in perspective, let me just zoom out for a minute. More years were added to average life expectancy in the 20th century than all years added across all prior millennia of human evolution combined. In a blink of an eye, we nearly double the length of time that we're living. So if you ever feel like you don't have this aging thing quite pegged, don't kick yourself. It's brand new. And because fertility rates fell across that very same period that life expectancy was going up, that pyramid that has always represented the distribution of age in the population, with many young ones at the bottom, winnowed to a tiny peak of older people who make it and survive to old age, is being reshaped into a rectangle. And now, if you're the kind of person who can get chills from population statistics, these are the ones that should do it, because what that means is that for the first time in the history of the species, the majority of babies born in the developed world are having the opportunity to grow old. How did this happen? Well, we're no genetically hardier than our ancestors were 10,000 years ago. This increase in life expectancy is the remarkable product of culture, the crucible that holds science and technology and wide-scale changes in behavior that improve health and well-being. Through cultural changes, our ancestors largely eliminated early death so that people can now live out their full lives. Now, there are problems associated with aging. Diseases, poverty, loss of social status. It's hardly time to rest on our laurels. But the more we learn about aging, the clearer it becomes that a sweeping downward course is grossly inaccurate. Aging brings some rather remarkable improvements, increased knowledge, expertise, and emotional aspects of life improve. That's right, older people are happy. They're happier than middle-aged people and younger people, certainly. Study after study is coming to the same conclusion. The CDC recently conducted a survey where they asked respondents simply to tell them whether they experienced significant psychological distress in the previous week. And fewer older people answered affirmatively to that question than middle-aged people and younger people as well. And a recent Gallup poll asked participants how much stress and worry and anger they had experienced the previous day. And stress, worry, anger, all decrease with age. Now, social scientists call this the paradox of aging. I mean, after all, aging is not a piece of cake. So we've asked all sorts of questions to see if we could undo this finding. We've asked whether it may be that the current generations of older people are and always have been the greatest generations. That is, that younger people today may not typically experience these improvements as they grow older. We've asked, well, maybe older people are just trying to put a positive spin on an otherwise depressing existence. But the more we've tried to disavow this finding, the more evidence we find to support it. Years ago, my colleagues and I embarked on a study where we followed the same group of people over a 10-year period. Originally, the sample was aged 18 to 94. And we studied whether and how their emotional experiences changed as they grew older. Our participants would carry electronic pagers for a week at a time, and we'd page them throughout the day and evenings at random times. And every time we paged them, we'd ask them to answer several questions on a 1 to 7 scale. How happy are you right now? How sad are you right now? How frustrated are you right now? So that we could get a sense of the kinds of emotions and feelings they were having in their day-to-day lives. And using this intense study of individuals, we find that it's not one particular generation that's doing better than the others, but the same individuals over time come to report relatively greater positive experience. Now you see this slight downturn at very advanced ages, and there is a slight downturn, but at no point does it return to the levels we see in early adulthood. Now, it's really too simplistic to say that older people are happy.
Okay, I think that's a good place to stop the video. I hope you found it as uplifting as we did. And with this, we can conclude our presentation for today. Even though we just scratched the surface of all of these various topics, I hope they have led to a better understanding of all the factors that influence middle adulthood.
In order to help facilitate discussion posts, we came up with a discussion prompt. And so here it is. Please incorporate theories associated with middle adulthood to the case of Amelia and write a discussion post on your thoughts about her case. Amelia is an African American who identifies as a lesbian woman. She grew up in a very poor neighborhood in Washington, D.C. She is very smart and has earned an MBA. She currently works 60 hours a week at a high-stress job and is single. She does not have kids. She is 46 years old. She has started to realize that her body and energy are changing. Amelia's health is not the best. She has put on weight, is more fatigued and forgetful, and she has diabetes. Amelia sought therapy because she is depressed and tired all the time. She would like to have a family and a partner, but does not know if she can handle these responsibilities with her work demands. You can read about a few more characteristics of her case on page
455 of the book, and the next 2 slides that we have are in regards to references.
So these are all of the references, including videos, the books that we use, the articles that we use to obtain all of this information. And the next slide has other references and videos you may want to check out that just has a few more videos and an article related to middle adulthood. Thank you very much.
Thank you.